Understanding COVID-19, the basics. COVID-19 is a disease. It is caused by a virus. This virus is a new type of coronavirus. Coronaviruses are a big family of viruses. Some of them cause simple colds in people, but this specific one was new to us. It can make some people seriously ill. We first learned about its existence in late 2019, and our understanding has grown since. The virus has a scientific name. It is called SARS-CoV-2. This stands for Severe Acute Respiratory Syndrome Coronavirus 2. The name itself tells us it can be serious. It primarily affects our breathing system, especially our lungs. It is related to other coronaviruses we knew before, but it has its own unique features and characteristics. Scientists have studied these features very closely. This helps us understand how to fight it effectively. This new virus first appeared in humans. It was initially identified in the city of Wuhan, China. This important discovery happened in late 2019. Most scientists believe it originally came from an animal source. Then it somehow made the jump to infect people. This kind of jump is called a zoonotic spillover event. It is how many new viruses often start their journey. Finding the exact original animal source can be a complex task for researchers. After it appeared, the virus spread very quickly around the globe. It did not stay in one place for very long. It began to travel across international borders and vast oceans. Soon it was found in almost every country worldwide. This rapid and widespread global spread led to a pandemic. A pandemic means an illness is affecting many people everywhere. It significantly changed daily life for everyone on the planet. It was a new and significant challenge for our global community to face together. The COVID-19 virus spreads mainly through tiny droplets. These droplets come from our mouth and our nose. This happens when we talk or when we cough. It also happens when we sneeze or even just breathe. If an infected person does any of these actions, the virus can travel through the air in these small drops. Being in close contact with an infected person is a major risk factor for transmission of the virus. There are other ways the virus can spread. Touching contaminated surfaces is one such way. For instance, if the virus lands on a doorknob or perhaps on a table, a counter or a phone, then if you touch that surface with your hands and then you touch your own face without washing your hands, your eyes, nose or mouth are entry points for the virus. This is why regular and thorough hand washing is so very important, though direct airborne transmission is generally more common for this virus. Many people who get COVID-19 experience a fever. A persistent dry cough is also very common. Feeling extremely tired or fatigued is another key sign. Some people, quite notably, lose their sense of taste, or they might completely lose their sense of smell. These particular symptoms can be early clues of an infection. Symptoms can appear a few days after a person is infected. The timing and type of symptoms vary from person to person. There are other symptoms people might experience as well. A sore throat can be one of them. Headaches are also possible for those infected. Some people report getting body aches and various pains. Importantly, some individuals have no symptoms at all. These are often called asymptomatic cases by health experts. Even without symptoms, they can still spread the virus to others. This makes the virus particularly tricky to control effectively. Everyone's experience with COVID-19 can be quite different. Wearing masks is a simple yet effective tool. Masks help to stop the virus-containing droplets. When you wear a mask properly over your face, you protect other people from your own breath. If other people around you also wear masks, they protect you. It truly is a shared responsibility within the community. Masks should always cover your nose and your mouth completely. This is where the virus typically enters and exits the body. Social distancing is another important protective measure. This means keeping a safe space between yourself and others. You should try to stay some distance from other people. This is especially true for people who are not in your household. About 6 feet or roughly 2 meters is a good guideline. This extra space makes it much harder for virus droplets to travel. Having fewer people gathered in one place also helps significantly. Try to avoid crowded indoor spaces whenever possible. This reduces the overall chance of virus spread. Good hand hygiene is absolutely crucial. You should wash your hands frequently. Use regular soap and clean water. Rub your hands together for at least 20 seconds. If soap and water are not readily available, use hand sanitizer. The hand sanitizer should contain at least 60% alcohol. This level of alcohol effectively kills the virus on your hands. Always do this after being in public places, or after coughing, sneezing, or blowing your nose. Clean hands are a very important defense. Other good habits can also help greatly. Always cover your coughs and your sneezes. You can use a tissue to cover them, or if a tissue isn't available, use your elbow. This simple action stops droplets from spreading far into the air. Also, remember to clean things you touch a lot. This includes items like doorknobs, phones, and light switches. These simple, everyday actions can make a very big difference. Everyone doing their part helps to protect each other. Vaccines are a key form of protection against COVID-19. They work by teaching your body how to fight the virus. Your immune system learns about the specific virus, it learns to recognize the virus and then attack it. So, if you happen to get exposed to the virus later on, your body is already prepared and ready to defend itself. This is a very safe and effective way to build strong protection without having to get sick first. Vaccination offers many significant benefits. Vaccines greatly reduce your personal risk. They lower your risk of getting very sick from COVID-19. They also reduce your risk of needing to go to the hospital. And most importantly, they lower the risk of dying from the disease. Even if you do get infected after being fully vaccinated, the illness you experience is usually much milder. Vaccines also help to reduce the overall spread of the virus. This protects not just you, but the whole community. COVID-19 has had a profound impact on the entire world. Many millions of people became seriously ill or unfortunately died. Our healthcare systems and hospitals were under immense pressure. Our daily lives changed in countless ways. Schools and businesses everywhere faced unprecedented challenges. The pandemic clearly showed how a new virus can impact us all. It remains a serious public health issue to this day. We also learned how interconnected and interdependent we all are globally. It is truly vital to get good, reliable information. You should seek information from trusted sources like your doctors. Public health organizations are also excellent sources of facts. Information about the virus can change over time. This happens as scientists and researchers learn more. So it is important to keep yourself up to date. This helps you make the best choices for your health and for the health of your family and community. Working together helps us manage this ongoing challenge.